Hello, YouTube. Today we had a very interesting day with the President of the United States, meeting with about 40 members of the House and Senate, Democrats and Republicans, to discuss our proposed legislation for making health care available to all Americans. We have some questions here that I'll read and respond to. The first question is from Chris from the University of Florida, who asks why health care reform legislation mandates health insurance. Excellent question. If you saw today, you saw the President answer this a number of times, and I will too. In order for us to have health care for America that is affordable, that is quality and accessible, it is important that everyone be in the loop. I maintain that health care for the most privileged American is better if everyone has access to health care. We're all under the electronic medical records and in the loop. But more specifically to your question, the bigger the pool, the lower the cost. The bigger the pool, the less chance that a catastrophic illness or someone getting cancer or whatever will raise the cost of the premiums for other people. In order to have quality, affordable health care for all Americans, it is essential that everyone participate when they are well and not just join in when they are sick. So it's all better quality, lower cost, more access if everyone is mandated, and that if every business is mandated to provide those benefits. But with that mandate must come assistance, subsidies to help people pay for the insurance, credits for small businesses especially, to be able to help cover health insurance, whether in the exchange or otherwise, for their employees. So if everyone's in, the pool is larger, healthier, and the costs are lower. Thank you. We're next. The second question is from Brian, who asked if I believe health care is a right or if health insurance is a right. Well, I believe that access to health care is a right. For some, it may be by insurance. For others, it may not. It may, if someone is on Medicaid or whatever. But it is, I believe, a right and not a privilege in a country as great as ours. No one has said it better than Senator Kennedy when he said it's not about the details of the policy, it's about the character of our country, the moral principle and the character of our country. Why are we the greatest country that ever existed, a country that is a major competitor in the international community, should be so low in terms of meeting the needs of our people when other developed industrialized countries provide health care and health insurance for their people. The third question is from JatPat of Chicago, who notes a study showing 40% of healthcare waste are due to unnecessary care and attributes that to being a result of doctors being fearful of lawsuits, and asks what's being done to address malpractice reform. Well, I don't, JatPat, I don't accept your basic premise. I do think that there is some waste in healthcare, and that's what we're trying to squeeze out of it in this bill. There is overutilization. People are getting more tests than they need for a variety of reasons. One of them is because doctors are fearful of lawsuits, but it's not anywhere like 40%. We have to balance the important value that we have of patient safety, and we also have to do away with frivolous lawsuits against doctors. So our bill goes in a stronger direction than has ever been done before to that regard. But what I say about that issue is, let's be entrepreneurial. In other words, other places in the bill, we have done away with unnecessary care. In certain regions of the country, there's more unnecessary care than others, and we have tried to level that and say this is about value, not volume. It's about quality, not quantity of tests and utilization and readmissions to hospitals. And again, for the part that relates to medical malpractice, let's be entrepreneurial in our thinking and find ways to reduce the lawsuits that are unnecessary and frivolous while we protect patient safety. The fourth question is from C. Rogers of Lincoln, Nebraska, who asks about health insurance being tied to employment and selling insurance across state lines. 100 years ago, over 100 years ago, President Teddy Roosevelt put forth the idea of access to health care for all Americans. It was largely an employer-based situation, and that is what has grown up in our country. And so therefore, what the President has put forth is something that respects the fact that most Americans who have health insurance have it as employer-based. Those of us, and count me among them, who've advocated for a single payer, and that think we would have had a better chance if we didn't have so many people insured under employer-based plans. But many millions are, probably nearly 200 million people, at least 200 million people, are in plans that are with big companies, and then many more in smaller companies. So employer-based health insurance is the backbone of what the health insurance availability is now. The legislation we're putting forth respects that, but tries to make it more affordable, so health care costs are not an anvil around the neck of businesses, so that they can be competitive, and so that the costs are lower and employers are more productive because they're healthier through wellness and prevention and access to health care earlier on. So that part of it. And then the next part, across state lines, well, we provide for that in our legislation, and the President listened carefully to what was said today about how we could possibly enhance that, so we're open to that. And again, there are provisions for interstate compacts in the bill already. The fifth question is from Blinn of Illinois, who urges that bills should be read by members of Congress. I agree, and they should be, and they are. We have reading sessions here where we read them together, and notes that there are thousands of pages long and should be written in clear language. Well, they are written in legislative language, which references the current law and the rest, and it isn't, shall we say, it doesn't flow. I agree. But we do have the annotation of that that is available, but people really actually want to see the legislative language. And if you're used to reading legislative language, you do see more specifically what the bill will do. I mean, it answers more of your questions that you may have. So we read the bill in two ways: the way it is written in legislative language, and a presentation of it in lay language, so that people know how they can, what it is they're voting on, and how they can explain it back home. But yeah, I mean, we should be reading the bills that we vote for. The other part of it is that they're long because the issues we're addressing are very complex, and where you're dealing with legislative language, you have to have the clarity to remove all doubt as to what is meant. But the fact is that we have a big vision. This is an opportunity of a generation, maybe of a century, to do something really important, on a par with passing Social Security, on a par with passing Medicare, and now on a par with passing health insurance for all Americans as a right, not a privilege. Thank you. Good night. Good night, YouTube.